very lucky. We've actually been joined by somebody who's actually done more than 45,000 successful eye surgeries in Pakistan and abroad. And the latest advances in cataract treatment as of 2024-25, which will reflect a lot of innovations. He's here to answer that. So ladies and gentlemen, without any further ado, we're very lucky that we have been joined by consultant ophthalmologist. He is Dr. Tahir Ayub Khan. Hello sir, assalamu alaikum, good morning, how are you?
Assalamu, thank you sir. Good morning. I appreciate your show. The world is changing every morning.
True.
Definitely.
And you people are updating us.
Thank you so much, sir. And you're even updating us as well by bringing newer technologies.
Yes, I'm here.
Exactly. So, sir, 45,000 more, successful eye surgeries. Let's speak about the advancement in the cataract treatment specifically first.
First of all, what is cataract?
Yeah.
Simply, cataract is the cloudiness of the natural lens. We have natural lens in our eyes. When it becomes cloudy, or in other words, it's become opaque, we call it as cataract.
Okay.
Cataract, the world reflects cat. You know, we have at night we see reflex in the cat eyes.
Yep.
So it's a long history how developed surgery, cataract surgery developed. But today, our ophthalmology, I mean eye science, has reached a stage when we are doing surgeries without any injections, without any sutures, stitches, I mean, and within 5 to 10 minutes, it is completed. And the man can go home on its own, no need of eye patches, and he can go to work after 3-4 days.
I think it's wonderful, which is why, sir, precisely I'm going to speak about the FLACS, because you've spoken about how, now we really do not have to inject, there's no anesthesia given to anyone, it's just a laser technology. So can you please explain a little bit about this laser technology and how does it work?
No, this is not a laser technology.
Okay.
Although laser technology is being used in cataract surgery, but first of all, I will talk about phacoemulsification.
Yes.
In this technique, we use a machine which produces ultrasound energy.
Okay.
And there is a small, very small, just like a syringe, injection syringe. Just like a thing, we have a small piece, hand piece attached to the machine, and with a needle, we insert it into the eyeball. It emulsifies, or in other words, you can say simply, it melts into very small pieces, breaks into very small pieces,
and then you take it out.
And sucks it out. And when it's clean, we inject foldable intraocular lenses.
Okay.
They're very soft, clear lenses. They are folded, and again, like a syringe type injector, they are folded in it. We inject just like injection. And when it goes inside the eye, it opens and settles down there.
Is it painful?
Huh?
Is it painful?
No, painful. We use topical. I mean, topical mean drops, eye drops, and numbing drops, anesthetic drops. A few times before going for surgery, and the patient didn't feel anything.
And I'm curious about knowing how common is this cataract surgery. I know that in my family, around all of the adults, my grandparents and my older dad's cousins and everyone, they have gotten this surgery. So it's very common nowadays. And what types of lenses are embedded in the eye after the surgery?
Very good, your very good question. Cataract is very, very common, and it is the #1 surgeries in the sense of number of surgeries in the world. Second is cesarean section, and #1 is the cataract surgery, because we have 2 eyes, and if the population of the world is it is double,
for example,
so it becomes
double the amount.
Eyes become 16 billion. #2 is the every third or 4% is having diabetes, and in diabetes, cataracts comes very early.
Right. Actually, we always thought it was genetics or maybe other factors, but how would we never?
Nowadays, I will say diabetes is the #1.
Yep.
Previously, it was thought it is the old age disease, cataract, but now it is I'm seeing in even young people, 20, 25, 30 people with diabetes.
True.
So it's very common. And second question, what type of lenses? we have a number of lenses. Foldable lenses, I already...
Intraocular lenses?
Intraocular lenses. These are foldable intraocular lenses. There are different types.
And different colors?
No, different. You can see colors, usually they are transparent and you can't see outside, just like cosmetic contact lenses. This is not color. One type of lenses we use, they are called monofocal intraocular lenses. They are far VN.
All right.
And usually they are cheaper, and routinely monofocal lenses are used. And for reading, we use glasses. Other lenses, which are multifocal lenses, they are far, near, and intermediate distance, but they are little bit costly, but they are being used. And
what about the life of these lenses, sir?
These are for life, whole life.
For life, that's it. I think it's great. But now, sir, we have a few more questions as well, coming from our team members who are actually listening to us as well. Do you think that, for children born with the condition of squint can actually be healed or recovered, or are there exercises where they can get better?
Yes. If a child is having squint, it should be immediately examined.
Okay.
Because if only one eye is moving outside, it can become blind because it is not focusing the light.
All right.
Brain is using only one eye, and other eye is being ignored by the brain.
True.
So first of all, an eye doctor will advise you to cover the good eye for it is called patching.
All right.
So that child starts using his squinted eye.
All
Okay.
right.
And first of all, we do refraction. Refraction means we check for glasses. If he need glasses,
So sometimes it can get better with glasses.
it can become bigger.
Okay.
But if it doesn't improve after a few years of using glasses, we can go for surgery.
All right.
And it is totally can be cured.
Wow, wonderful. It can get better as well. So
Yeah.
one
That's
last
great
question,
news.
before Isha
Definitely.
actually has to ask another question as well. And that is that, sir, these days, even kids, even adults, everybody's on screen. How damaging is it for people? Please go ahead, share it with them. थोड़ा गुस्से में बताएं जरा उनको कि यार इतना नहीं देखना होता.
It is very, very dangerous.
And how damaging is it? You have to share examples.
Yes. I have seen young people. I have even recorded their videos
Okay.
on my laptop. They are very young. A guy who was doing what's that game?
PlayStation,
No,
Xbox,
no, very famous
Fortnite.
Fortnite.
some game.
Some
I
game,
forgot that name. Very famous.
All right.
He was playing on that game for more than 24 hours without going to washroom, without eating something. He was in some contest, and his kidneys were failed.
Oh my gosh.
He is on dialysis now. Other thing, when we focus on screen for a long time, our eyes are slowed down in blinking. This blinking is very important. 14 to 16 times a minute is very important, just like windscreen of a car.
Yep.
All
This
right.
our eyes become dry, and when dry,